What most people don't know about PTSD is that it's actually only one of 5 different disorders in the category known as trauma and stressor related disorders. So, I'm going to give you a quick breakdown of each, the similarities, differences, and the last one may just be the most severe and you probably haven't heard of it. First, we'll start off with PTSD because these symptoms represent the core of this disorder category. Essentially, it is a reaction to severe trauma, whether that's complex, meaning a series of traumas throughout one's life, especially in childhood, or a simple trauma, a singular event like experiencing a natural disaster or violence. Then we have acute stress disorder, and this is when you experience the same type of trauma, same symptoms, however, it's less than 30 days after it happened. A lot of times we can experience something significant, it shakes us up, but it goes away over time. However, if it doesn't and it's past 30 days, then you could diagnose PTSD. Now, this next one is kind of a joke among therapists because when you don't want to have to give a diagnosis, but you're required to, typically your go to is adjustment disorder. Now, this is very real. It's when you experience a significant change in your life that causes stress, therefore leads to depression and or anxiety symptoms. If it's less than 3 months, it's considered acute. If it's more than 6 months, well, that's prolonged, and then you could give that diagnosis of depression, anxiety, or anything else. This last one was all the rage because a few years ago, when the new diagnostic manual came out, they added a brand new disorder, and it happens to be in this category. That's known as prolonged grief disorder. Now, this is similar to adjustment disorder. However, it's when you experience a significant loss in your life and the grieving process gets stunted. It may be normal to experience grief after a huge loss, and it is. However, if after 12 months you still feel like it happened yesterday and it's having a really significant negative impact on your life, you could diagnose this. Now, a quick add on is not everyone meets the symptom criteria for one of these disorders. Every category tends to have a little wiggle room. That's why I like to use other specified trauma and stressor related disorder, kind of like a PTSD light, where you can give a diagnosis to justify treatment, but it doesn't meet full blown PTSD. Now, you could also use unspecified, basically meaning you're not quite sure yet. Now, this last one could be the most severe. That's known as reactive attachment disorder. This is defined by individuals often in infancy or early childhood who do not get their basic needs met, like physical touch, being held, or getting proper nutrition. These individuals experience a significant attachment disruption where they have difficulty attaching with any caregiver. However, in rare cases, it can be the opposite where they attach with almost anyone indiscriminately. These kids struggle with severe emotional dysregulation, anger, rage, often at their caregivers. These kids can experience cognitive delays from that lack of nutrition, leading to learning problems, behavioral issues, even antisocial type behavior.